I think that the main misconception that people have with regard to memory loss and ageing is the concern that any memory loss may equal dementia, and of course it doesn't. And that's why it's important to have memory loss assessed clinically with testing to define the extent of the memory problem. And it's not the sort of thing that a person can judge for themselves. It's a little bit like blood pressure. You don't know what a person's blood pressure is by looking at them. You have to measure it. Just in the way that you can't really tell what a person's memory function is until you formally test it. Significant memory loss would really result in a substantial impact on sort of daily function. And you know, if we think about that for a moment, it wouldn't just be forgetting the occasional name or putting your keys down and 30 seconds later remembering where they were. It may be, for example, losing an important item and having no idea at all where it is. It may be becoming more repetitive in that a person just simply does not remember that they have told a particular story several times already that day. So these would be a couple of examples of what I would call more significant memory loss. I think that what worries patients and families most about memory loss is the possibility that it could be the early stages of a dementing illness. And of course this is completely understandable, and I think that as healthcare systems advance, the awareness of the importance of memory loss as a potential early symptom of dementia is gaining greater attention, and I think that's a very good thing. I think the main challenges in the future for Alzheimer's disease are going to be the early detection of the condition. And this would be a tremendous advance if we can use the new technologies, the biomarker tests that are being developed, such as measuring proteins in spinal fluid, gene tests, advanced scanning techniques, to know with a much greater degree of certainty if a patient is in fact in the early stages of the illness. And then once that's been defined, to have treatments available that we have tested and that we know can have an impact on the disease process. And if those things happen, then Alzheimer's disease, in the form that we currently know it, could become a condition of the past.